Hi everyone, welcome to Global Medical Education Hub, a channel that provides authentic and credible medical content for medical students. I am Maria Aziz, I'm a physician by training. In this video, I will give you a deep dive into the causes of chest pain and the diagnostic studies that a physician should order for the patient. Chest pain causes can be divided into two big categories. Number one, cardiopulmonary. Number two, non-cardiopulmonary. In cardiopulmonary, we have cardiac causes and pulmonary causes. Under cardiac causes, the most common cause of chest pain is myocardial ischemia, pericarditis. Under vascular causes, we have acute aortic syndrome, pulmonary embolus, pulmonary hypertension. In pulmonary causes, most common cause of chest pain is pneumonia, pleuritis, spontaneous pneumothorax. In non-cardiopulmonary category, we have GI causes, that's gastrointestinal, like esophageal reflux, esophageal spasm, peptic ulcer, gallbladder disease. Now, when a patient comes with the symptom of chest pain, the physician orders a couple of diagnostic studies. So this is a list of the diagnostic studies commonly ordered by the physician to do a differential diagnosis of chest pain. That is, they try exploring what's the exact cause of the chest pain by ordering all these diagnostic studies. They order a couple of imaging studies, they order a couple of blood tests. So let's go through this list. CK-MB, troponin, these are the cardiac enzymes that are being ordered. 12-lead EKG, graded exercise test, that's stress test. Couple of imaging studies are being ordered. Arterial blood gas analysis, chest X-ray, echo, cardiac catheterization, endoscopy to rule out GI causes, amylase and lipase to rule out any pancreatic cause, CBC and ESR. Now let's take a deep dive into each test, like why these tests are being ordered. What's the rationale for ordering these tests? CK-MB, the serum level of CK-MB is usually elevated above normal in the first few hours after MI, and this returns to normal within 72 hours. So to diagnose MI, CK-MB is very helpful. If you see an elevated level of CK-MB within first few hours after MI that returns to normal within 72 hours, that's helpful to diagnose MI. Troponin, this is another cardiac enzyme, an inhibitory protein that's found in muscle fibers. This enzyme is elevated within 4 hours of MI and stays elevated till 7 to 10 days. So with CK-MB, there is elevation of troponin also. This test is more sensitive and specific than creatine kinase for cardiac muscles. This enzyme could be found falsely elevated in patients with kidney dysfunction also. Now the next one is 12-lead EKG. The practitioner should look for signs for acute ischemia such as ST segment elevation or depression, arrhythmias and conduction delays. Graded exercise test. This is the stress test that helps in diagnosing coronary artery disease, angina, and establishing safe exercise levels. The addition of the radioactive substance like thallium, this helps to determine the extent of the coronary artery blockage and the blood flow both at rest and with exercise. Transthoracic echocardiography, commonly TTE. It's an older non-invasive technique. It's used for simple assessment of overall cardiac health. It helps in the diagnosis of aneurysm, pericardial effusion, and other structural abnormalities in the chest. Cardiac catheterization. If symptoms are highly suggestive of ischemia, cardiac catheterization can assess the need for revascularization or CABG. CABG is coronary artery bypass graft. Urgent reperfusion with angioplasty or coronary artery stenting must be performed promptly, ideally within 90 minutes of onset of MI, in order to minimize the amount of cardiac muscle damage. Like if the physician is looking to minimize the amount of cardiac muscle damage, this time window is very important. Within 90 minutes of onset of MI symptoms, urgent perfusion with angioplasty or cardio or coronary artery stenting must be performed. Coming to endoscopy. Endoscopy is usually done like once you rule out all the cardiac causes of chest pain. Then endoscopy is done to rule out the gastric cause of the pain. Amylase and lipase. Once the cardiac origin of the chest pain is being ruled out, couple of blood lab tests like serum amylase and lipase is being ordered to rule out GI causes. Amylase and lipase measures help us in assessing the diagnosis for pancreatitis and cholecystitis. So pancreatitis is a disorder of the pancreas, cholecystitis is a disorder of the gallbladder. CBC, ESR and chemistry panel. These blood tests help us to rule out pericarditis.